Welcome. Thanks for tuning into The Good Nurse Outlook, a podcast about life from a nurse's point of view. But if you're not a nurse, that's okay too. Not only will I discuss things nursing and healthcare related, but everyday matters as well. Honestly, the topics are endless. I'm your host, Nurse Naj. Let's get into it. Hey, you guys. Welcome back. Welcome to the Good Nurse Outlook podcast. We are on, I don't even know what episode we're on. I never know what episode we're on because I kind of went on a fake hiatus. I don't know what happened. Actually, okay, I do know what happened. It's just been a lot going on. You know, I've been in between nurse contracts. I was on one contract that was like really just doing too much for me, and happily that's over. And then I was working on another contract, but it didn't really feel right. So I'm just like in between contracts right now. Chart Like a Boss is selling. It's doing amazing. I am actually wearing Fabletic scrubs. I'm partnering with Fabletics, so I just love that. These scrubs feel amazing. Yeah, I'm just working on creating content amidst, selling books, going to work, and other things that I do, also being actively involved in my church. So yeah, just a lot of stuff. Just a lot of stuff. Let me check and see what episode we're on. I need to start season 2. Maybe I'll just start season 2 after this. But I feel like I don't want me making my podcast to feel like a job, I need to make content every week. I need the followers. I need the views. I just want to make it when I make it. And, when I don't, I don't. Be like Carisha, please. Except for I don't have celebrity guests. I'll start doing other nurse collabs as something I surely want to get started. I just have to figure out how to do the Zoom podcast. I could have just checked on my phone. I'm doing all of this. Thank you so much for tuning in. Even if you're not a faithful tuner in, I don't even know if that was a real word. Even if you're not a faithful listener, you kind of I'm not a faithful poster. So, we're in the same boat. We're doing the same thing, man. I smell so good. Do you ever just spray perfume? I like to spray perfume. Right now I have Chanel. I think it's Chance, maybe, but I could be wrong. So don't quote me on that. I ran out of my other perfumes and that one was in the back. But nonetheless, anyways, not about perfumes. Today we are talking about time management and tips on time management. So this would be for new grad nurses. This is for nursing students. This episode is for anyone who is struggling with time management in the field of nursing. Some of the things that I see with a lot of new grad nurses and even experienced nurses, of course, you want to try to create a flow of your day. You have these ideas as a nurse, how you want your day to go about. I go into work and I'm like, all right, I'm going to be charting by this time. I'm going to start meds at this time, meet rounds, because I do per diem. I work in med surg, and when I'm not doing med surg, I'm doing travel emergency nursing. I did get my nurse practitioner license last week, but there's still other licenses that I have to get on top of that. So that'll be next year's problem. It won't be this year's problem. Yeah, so I like to plan my day, and I'm like, I want this done at this time, this done at this time, this done at this time. But of course, as a nurse, you can want things to go your way as a nurse, but nursing is so unpredictable. You might have a patient that's demanding. You might have a family member that's demanding. You might have a boss that's demanding. So aside from your nurse duties and, wanting you to write your name on the board, which is okay, we've all, just do it. Write your name on the board and just fill out the whiteboard. And just, I feel like some people, when it comes to nursing, they complain about certain things. But writing your name on the board is something that you have to do. So don't complain about it. When you go in a room, you should kind of straighten it out, clean it up. Don't have you see the patient and they have a bunch of trash on their table or different things. Tidy up your space. It's their space, but it's also you're the nurse and you're overseeing the room. So it kind of has a look on you, because if the manager's going around doing rounds, why is the urinal full on the bed, on the bedside table? You just want to make it look good. That was a sidebar, but I just really hate it when I go into other rooms, they look a mess. And, I know we have a lot to do as a nurse, but you could be assessing the patient and cleaning the room. And I know they're well, we're not housekeeping. Yeah, but as a nurse, you're always something. You're housekeeper, you're secretary, pharmacy tech, whatever you need to be in that moment. You never know. Things are so unexpected. So you can have all these things going on and nothing really goes as you plan. But you need to plan for those uneventful things too, right? Some nurses, they always leave on time. Even me, I think I'm pretty experienced, but I know why I don't leave on time all the time. I'm talking to the patients. I'm joking around. Some people are just I got to be done with charting by 8:30. I got to have my meds out by 9:30. I need to be in rounds by 10:15 and no later than that. And I need to only spend 20 minutes in rounds or 15 minutes in rounds. Then I need to hang on all my meds. I need to do all my blood sugars. I need to chart. I need to do this. Those nurses are just task focused and they do not divert from that path, which is like not me at all. I am going to be in the room talking with you, joking around. I'm going to be like educating you. I'm going to be like assessing you. I'm writing detailed notes all the time and just like communicating with the doctor and different things. Like I'm like a serious but playful nurse, and I love to educate my patients, especially in a way that they understand. Code switch. You can't want a patient to understand and you're speaking on them, you're high almighty. I'm playful, but I'm also serious and I educate. Also, like, I know my stuff. So I feel like when you know your stuff, you could be all those things because you can like educate and joke around, but you can also like get work done. I could talk to you, ask you how you're doing, and I'm like, okay. I was like, hey, how you doing? And I'm like, it's okay if I clean this up, if I do this. Oh, I'm writing my name on the board book. You know, how you feeling? Da, da, da. You know, communicate, do tasks and communicate. And you can assess all in that, but it takes time. It takes experience. Like, it's not something that you're going to get right away. Eventually, you will be able to like talk to a patient, write your name on the board, and like get an assessment done in like 5 minutes or less, honestly. Hey, how's your day? Can you raise your hand? And then they're raising their hand like, oh, my day was pretty good. You have any pain here? You touch it. You know, I'm not going to go into all the details, but there are ways. I guess I could go into the details, right? It's an episode. Some nurses are just strictly like this. Then you got nurses that are me, that are like, I'm like this sometimes, but then I'm like, but it works out for different people. There are so many tips that can be given in regard to time management. I'm only going to give you three. These three, I feel like they're pretty solid. And honestly, if you get them, you got it, you're good. So the first thing you want to do is create a flow. You want to identify your priorities based on your patients, based on the tasks that are at hand, based on the needs. You want to prioritize that. The med-surg flow is different from an ER flow. We are doing like critical care, and non-med-surg, you're not doing critical care. At a critical care level, you're going to be assessing your patients differently from med-surg. But like if you're a med-surg, because most new grads start in med-surg, but you don't have to start in a med-surg, you can start in a critical care. Like, I don't think you have to start med-surg, but I'm just going to use med-surg as an example. I come into work, I have 5 patients. I have, out of those 5 patients, I have 3 blood sugars. Okay, 3 of those are blood sugars, so I need to make sure at 7, 11, and 4, I have their blood sugars. So no matter what I'm doing today, I need to make sure I have that window open to get those blood sugars. You come in at 7, usually the blood sugar is done. So you're just concerned about 11 and 4, but don't get tricked up because meds happen and all this other stuff and you can forget. Just like that, and then lunch is here and you're like, panic. Those are like a priority. You want to make sure you get your blood sugars for those 3 patients. Another thing is a patient's MPO. So you want to make sure their sign is up on the door. That would be a priority, especially if you're getting a report and they're saying, oh, the patient's MPO for surgery. Make sure the sign's on the door. Don't even let them finish talking. Make sure the sign's on the door because there's so many times that patients eat or sneak or get a hold of food. It doesn't even matter. It could be written on the patient's board. Put the sign on the door. Put it on the back of the bed, anywhere, just to make sure, because there's so many times where patients are staying in the hospital for an extra night because the sign wasn't put out. And then it falls on the nurse. Everything falls on the nurse anyway. And also like restraints, making sure those are renewed. You need to know that if your restraints are expiring at 9 or 2 p.m., you don't want to go over the time and then someone walks in, your patient's restraints, you don't have an order, and now you're in trouble restraining your patient against their will or whatever the case is. When it comes to time management, focusing on your priorities is a must. Sometimes, especially as a new grad nurse, you're so focused on your task. You're so focused on your time limits. Like, I want to be done by this, right? You're like time, task oriented. And it's not going to always work out like that, especially if something happens and you need to chart. But because it doesn't work out how you planned it, don't just think, oh, my day is going to crap. There's always time to just pick it up and start. What is this word I'm looking for? There is always time to reestablish a new flow. If you want meds passed at a certain time, but let's say something happened and now you're backed up, don't let that frustrate you. Pull yourself together, revisit your task list, your priorities, and be like, okay, what can I push back so that I could do this? This took longer than I expected, or this happened unexpectedly. Don't be afraid to ask for help. Oh my gosh. So many, I don't know what it is with these new grads not wanting to help. Are the girls mean at work? Like, what is it with people not wanting to ask for help? If I need help, I don't care. I could act like I'm Superwoman all I want. I really think I'm an amazing, perfect super nurse. Yeah. But If I'm trying to get a stick on a patient and I can't get the stick and I know I need blood sugars, I'm going to ask another nurse, do you mind to do my blood sugars? You already got the machine in your hand. Most likely they aren't going to say no. And now I don't have to worry about fishing on a patient to make sure I get the IV access. And really, I could spend my time focusing on that. I could delegate to another nurse or a CNA, but normally you don't have tech. Sometimes it's so rough. You don't have a tech. Don't be afraid to ask for help. And a big rule of mine is chart 1 hour within seeing the patient. I don't mean to do like your whole full flow sheet notes, head to toe review of systems. Like, no, I'm not talking about that. I'm talking about any type of note. Patient alive, of course. That's not like a real note I would write, but you know what I mean? Don't write the same time for every patient. That is going to get you trapped up in case something happens. You in 5 patients' room at 7:30 at the same time, like 7:30, 7:35, 7:40. I know a lot of people stay late due to charting, and this is when tip number 2 comes in handy, and it is so important. So number 1, create a flow, prioritize your patients, the task at hand, and just try to stick to it. But if you can't stick to it, don't worry. Just breathe and then reestablish a new flow. Number 2, tune out distractions. Tune out distractions. I know nurses get to the station, they want to chart and they want to talk about what did you do this weekend? What did you do last night? How was this? How was that? Don't do that. Focus on the task at hand. Yeah, you can speak, be friendly, but don't get distracted in, nurse's station and are the things going around there, because most likely the nurse you're talking to, she's expert at this. She's already done flew past everything. And if you are both new and y'all talking, y'all really should not be talking. If it's a new patient you don't know, let me review the H&P. Let me check out the orders that's open. Let me see what I need to be doing. What are my priorities for this patient? Let me see how I can write a note within the first hour. One of the nurses are your friends and she's going in there to do an IV and you're like, oh, you want me to come in there and help you? Like, unless you really need to be in there, like if it's a combative patient or something like that, but don't just go in there so you could talk and then y'all talking and y'all catching up. It may sound silly, but some people do that. Some people just offer their help to other nurses that don't necessarily need it in that moment. And number 3, which I kind of said this earlier, but delegate. Don't feel like you have to do everything by yourself. You lose nothing as a nurse. You have your license, you have your pride, you have your knowledge. You lose nothing as a nurse asking for help. It will just make your day so much easier. I can do so many things by myself, but why would I want to? And I don't mean like delegate, oh, you don't want to clean the patient, so you delegate that to the CNA. If you're in the room with the patient and you're passing out meds and they want to be on the bedpan, put the bedpan under the patient and let this tech or CNA know, hey, patient's on the bedpan. Would you be able to get them when they ring? But don't be like, I'm charting, I can't move. Can you call the CNA to, I don't even know. I don't do that. So I don't even know how to pretend to do it. But, if you're already in the room or even the patient may want to get out of bed, go to the chair, it's going to cost you nothing. And then, you know what? It's better that you do it because you're already in the room than you trying to look for the CNA and she's busy or tied up doing something else. And then now the patient keeps ringing, you're comfortable, you're charting. And now you got to get up and go back into the room to take the patient to the chair. Do what you can when you can, but if you can't, delegate. Don't think, oh, I'm always asking for help. I mean, but don't always ask for help. Like, because some people I know, they will abuse somebody. They will be like, oh, can you do this? Can you do this? And then somebody be like, I remember that happened to me before. This one nurse is like, oh, can you do this? And I was like, oh yeah, sure, no problem. I was already doing something. And then she's like, oh, can you do this? And then I'm like, okay. And then she's like, oh, I can't get this stick. And then I'm like, then I found out this girl wasn't even trying. She wasn't trying to get no sticks. She wasn't trying to do no blood sugar. She wasn't trying to answer the call bell. She wasn't trying to do anything. She was just trying to see how many nurses she could get to help. And once I figured that out, I was like, no, I cannot help you. I'm sorry. You have to look elsewhere for help. I'm doing your job, but I'm not getting you a check. I'm just kidding. But no, I'm serious though at the same time. Those would be 3 time management tips that I have for you. Create a flow, tune out distractions, and delegate. It's easy to establish a routine that works for you. And sometimes I find it best to like prepare, think about how your day went and think what could have went different. And also try not to feel so bad if like things didn't go how you wanted, or if you felt like somebody came down on you, or, you wish you would have did this different, because every day is a new day and you're still learning, still processing things. Nobody's perfect and people make mistakes. Doctors make mistakes, nurses make mistakes. Everybody makes mistakes and everybody needs to be just giving each other grace. But you do, as a as a nurse, you need to take accountability for your actions and your behaviors, and you should try to become better every day. You shouldn't have the same things happening to you over and over. Like, dang, why every day I'm staying till 9 o'clock charting? Like, you need to figure out what is making you stay till 9 o'clock. Are you spending too much time in the patient's room? Are you unable to get out of the room because you take a long time to do assessments? If you're taking a long time to assess patients, then you need to practice at home. In the beginning, I bought nurse books, I bought assessment books, I was learning EKGs at home. I mean, just because you have your nursing license, it doesn't mean like your education is over, like that you're not continuing learning. Of course, you take CEUs every time that you renew your license, but still, like you are in a profession that's constantly changing and evolving, and you become a stronger nurse when you use outside resources in your private time, right? So you're not living this luxurious lifestyle where people are like, I'm working for 3 days, then I'm island hopping, I'm on a yacht, I'm on a boat, I'm on a trip, I'm on a plane. Like, no, you are like, okay, I'm off this day. So let me try to brush up on my assessments. How can I do quicker assessments? Or how can I chart better? Chart like a boss, a documentation guide for nurses. That's how you could chart better. You want to just do stuff in your own private time, because you will see that sacrificing your private time to become a stronger nurse or becoming stronger in your skills, it will make your work life balance so much better. Anyways, thank you guys so much for tuning in. Thank you for being faithful. Thank you for listening. And thank you for spreading my content, sharing my content, liking, and, just leaving messages. What are some tips that have helped you as a nurse? Maybe you can leave them in the comments. Yeah, God bless you. Bye, and have a good day.